everybody, welcome back to my channel. If you are new around here, my name is Olivia and I am a 4th year medical student. Now many of you will be starting university and specifically medical school in the next few weeks, which is so exciting, and you will be entering a phase of your medical training called your pre-clinical years. Now if you're unfamiliar with this terminology, traditionally a medical degree is around 5 to 6 years and your first 2 years are spent in what's called the pre-clinical phase. And this is the phase of med school you enter before you start your clinical placement, and it's where you learn your basic sciences, the science underpinning medicine, science underpinning disease, and you learn your anatomy, your physiology, your embryology, biochemistry. Basically you're learning a variety of scientific subjects. Now clinical placement comes with its own challenges, but I actually found my preclinical years to be some of the harder years, and that's because there's just a wealth of content to learn. There is so much, the content is so vast, and you do have continual assessments, progress tests and big exams at the end of the year. And so it can be really overwhelming, and I sometimes find that the lecture material is some of the worst material to revise from because they really do just throw everything at you, and I just feel like there are so many other resources that are beneficial to use in addition to your lecture material. And so for today's video I want to give you all the recommendations and resources that I used in my preclinical phase to pass all my exams and move on to my clinical phase of my medical degree. Okay, so anatomy has always been my arch nemesis, and it is the subject I found the most difficult, hands down, in my preclinical years. So I have many different recommendations as to how to revise anatomy, and the first one, which you will have heard me talk about before because I'm just a huge fan, is the Netter's Anatomy Colouring Book, and this is an Elsevier product who are the kind sponsors of today's video, so thank you very much. I've been talking about this book for a very long time. This is something you will have seen me mention if you're a keen watcher of this channel. I have such distinct memories of taking this book with me in my first year onto my waitressing shifts, because I usually had a 2-hour period where it was really quiet when the restaurant was shut, and I literally took this and I coloured it in. I just feel like it's the perfect resource for learning anatomy if you're a very visual learner. It's really good because it has a little bit of description here as to what you need to know, and I just highlighted that. And it's got all the important anatomical landmarks, and then obviously over here you've got your colouring page, and as you can see I coloured it in. I literally remember colouring this in on a shift. Honestly, most of my anatomy knowledge comes from this book because I found it so helpful, and again I found this so much more beneficial than flicking through a very traditional text-heavy textbook. The next resource I'm recommending for anatomy is actually an app. I really recommend you download this one, and it is called Complete Anatomy. It's absolutely amazing. I don't know how they do it, but it's actually really fun just to interact with it and like rotate the anatomy and look at it from a different perspective, and that just makes it way easier to understand sort of in time and space. And then another thing they have are courses, and I think these are really cool. So you have courses in things like interpreting ECGs, and then looking at things like anticoagulation, just things that are a lot more tricky to understand in medical school, and I found these really helpful as well. I feel like with anatomy you just need a combination of things. Keep it interesting. It can be really overwhelming to learn. Obviously there are so many different muscles and nerves and blood vessels that supply the body. It can just be a really steep learning curve, and I think that's why I found anatomy so difficult. So I definitely recommend exploring all the different resources and seeing what works for you. The next thing I'm going to recommend are a few YouTube channels which I absolutely love and I've used extensively throughout my degree, even now, to understand various conditions and preclinical content. And the first one is the YouTube channel by Dr. Mike and Dr. Matt. I really love how they explain things. They stand in front of a whiteboard and it feels like you're getting a mini lecture, but again I feel like they just cover the salient pieces of information instead of padding it out like your normal lectures at university. So I feel like that was really helpful to complement my lectures, and I absolutely love their channel. The next channel I recommend is probably going to be familiar to a lot of you if you've been doing like a pre-med course or lots of biology, and it's the YouTube channel by a guy called Armando. It's probably one you guys will recognise. He does unreal videos. I don't know how he manages to draw everything in the detail he does, but they are so visual, they're so interesting. And then, as I recommended in my previous video, I really recommend you check out Osmosis. They have tons of free videos on YouTube, but I also really recommend looking into the subscription for it because it is just a fantastic resource. There's tons of videos on anatomy, tons of videos on physiology, and they're really interesting, they're illustrated really well, and I really enjoyed using them as a learning resource resource, especially when it came to preparing for my exams. The next thing I recommend you start using in your preclinical years is a program called Notion. You will have probably seen this if you're kind of within the sort of study tube, study world. It's an amazing bit of software that you can download on your laptop, or you can have it on your phone as well, and it just really helps you stay organized, and you can use it for so many different purposes. So a lot of people use it to stay on top of deadlines and tick off things they need to do and create like a spreadsheet almost of what they need to do. I personally used it to write out questions that supported my lecture content. Instead of just writing notes in a traditional format, what I did was I turned my lectures into questions which I thought were examinable on my future exams and tests, and I created them using Notion because they have this really nice toggle feature where you can write a question, have the answer hidden, think about it, and then reveal the answer. I started writing questions for myself in year 2, but I wish I'd started from year 1, and I basically just put all my modules here. As you can see, I had a fair few, and then what I'd do is I'd click on one, and you know, for week 1 these would be all the lectures I had, and I just turned the lectures into questions as I said, and I really found that helped me. So you know, for example, where is the sinoatrial node? Right atrium, and that would be my answer right there. Definitely recommend checking out Notion. It's a very powerful piece of software to use. Okay, and then when you're getting towards your preclinical exams, it's getting towards that sort of April, May time, I really recommend you start looking at question banks. Again, this is something I never made use of in my first year. I only really used it extensively in my 3rd year, and I really regret not doing that. So the ones I recommend are firstly PassMed. I think this is going to help you out the most if you're in your preclinical years, because it has so many questions aimed at year 1 and 2. And then as you move up in med school, you can look at the more clinical content. And what I really like about PassMed is years 1 to 3 are actually free. So you can have all those questions at your fingertips for free. And then only when you move on up, you start having to pay a bit more for the subscription. You really can't assess how well you understand things until you force yourself to actively recall them. And this is like my ultimate tip when it comes to studying for your med school exams. Do not just read your notes, do not just write notes and think that you're going to know them by the end of it, because the chances are when you're faced with all that information in your exam, it can be really overwhelming. So you really need to get into the habit of testing yourself frequently and testing yourself on a variety of different areas, be it anatomy, physiology, etc. And I think PassMed is really good for this. As you move on up, I recommend QuesMed because I think this has some really powerful clinical questions, and I've really found using a combination of PassMed and QuesMed has been really helpful for me. And finally, the last thing I want to recommend to you guys for your preclinical years is a study app that really helped me stay focused. If you haven't heard of it already, it's called Forest, and it's a really simple concept. It's basically an app that you open and you plant a tree for a allocated amount of time, so that could be 20 minutes or 30 minutes or an hour if you're having a longer study session. And the point of the app is you're not allowed to look at your phone, you're not allowed to check notifications, emails, etc, because if you do, your virtual cute little tree will die. It's really weird, but you feel like a real sense of achievement when you see new trees popping up, because if you complete your study session, your tree appears in your like virtual little forest. I think it's a really great app. It's really helped me stick to like my timetable, because I know that, you know, I've got a 30-minute block here I've allocated to revise some cardiology. I just think it's a really cute app. It's really simple, but it really helps me stay focused. So I highly recommend downloading that, especially when it gets to your exam season and you really need to be disciplined with how you're studying. Okay, so those were a lot of different recommendations for you, but these were truly all the things I used in my preclinical years in addition to my lecture material. Obviously, each uni is going to be slightly different with what they expect you to know, so do ultimately make sure you're looking at your learning objective and you're establishing what it is you need to know, but don't feel scared to branch out and look at some, I guess, less traditional resources that your lecturers may not recommend. I really feel like there are so many other interactive and visual things that you can use to help your learning, and these are some I particularly loved. Thank you so much once again to Elsevier for sponsoring today's video. Do make sure you check out their anatomy colouring book, the Complete Anatomy app, and also the amazing Osmosis platform. These are all fantastic and they're all things that I continue to use and I absolutely love. I wish you the very best of luck in your preclinical years, And if anyone else is watching and they've gone through med school or they're currently going through med school, let me know some of your favourite resources to use also. Thank you guys so much for watching, and I'll talk to you soon. Bye!